Hello and welcome to the Feeling Good podcast. I am your host, Fabrice Nye, and joining me here in the Murrieta studios is Dr. David Burns. Hi, David.
Hi, Fabrice.
Dr. David Burns has been a pioneer in the development of cognitive therapy, and he is the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 20 languages. He is an emeritus adjunct clinical professor of psychiatry at the Stanford University School of Medicine. Welcome to episode 84 of the Feeling Good podcast. This is part 2 of our role-playing techniques, today with another member of the Tuesday group. Hi, Eleanor.
Hi.
And we're going to demonstrate, or David and Eleanor are going to demonstrate today, the paradoxical double standard technique. And before starting, maybe, David, you want to say a few words about what's paradoxical about it and what's the double standard part of it.
Okay, the paradoxical double standard technique is a technique I developed, but it was based on a live demonstration I saw when I was a resident at University of Pennsylvania Medical School. And Maxy Maultsby, who was one of the early rational emotive therapists in the Albert Ellis type movement, came and he did a live demonstration with a woman from the inpatient unit, as I recall, who had borderline personality disorder and severe depression. And she had the love addiction, and one of her thoughts was, I can't be happy without love. And I think she had just broken up with her boyfriend, and she'd become depressed and suicidal. And he used a technique which I had never seen before. In fact, I was pretty green and hardly knew anything except the supportive listening I was being trained in as a resident. And he kept asking her, would you say things like this to a dear friend? You know, like you're hopeless, you're going to be alone for the rest of your life. You can't be happy without love, without John's love. And I didn't think it was going to work. And by gosh, she started coming up with, no, what I would say to a friend is you were happy before you met John, and you can be happy without him in the future, and stuff like that. And she started coming up with really, really good positive thoughts to contradict her own negative thoughts. And lo and behold, by the end of the session, which was about an hour, she was just feeling a whole lot better. And so I thought, well, wow, that's a really, really cool technique. And then what I did is I turned it into several other techniques, all called the double standard technique, but to make it a bit more powerful. And the one that we're going to demonstrate tonight is called the paradoxical double standard technique. And what you actually do is you well, first of all, why does this technique sometimes work? The reason it works is because most of us, including those of you who are listening right now, most of us have this double standard. Like when we screw up, we beat up on ourselves with all these harsh, distorted, self-blaming statements. If we were talking to a dear friend, we would talk to them in a reasonable way, a loving, compassionate way, a rational way, rather than all these mean, distorted statements. And so the idea is, would you be willing to talk to yourself the way you talk to a dear friend? But the way I'm going to do it is I'm going to become, Eleanor, your dear friend. Read your daily mood log here so the listeners will know exactly what negative thoughts and feelings we're going to be seeing if we can blow away with this technique.
Where do you want me to?
Just start the event, the emotions, and the negative thoughts, and then we'll choose one and launch into the paradoxical double standard.
Okay. So the upsetting...
So just tell us a little about who you are and what you do.
My name is Eleanor Scott, and I'm a licensed marriage and family therapist, and I have a private practice in the South Bay in Morgan Hill.
And you're active in the local clinical social worker association, is that?
I'm on the board of the Santa Clara Valley chapter of CAMFT.
Yeah. Cool.
Okay, so my upsetting event was last week in the Tuesday group. And the other people there were other group members, and we were working on a particular technique called process resistance. So that's the event. And my emotion, so unhappy. Do you want the percentage? Mm-hmm. So unhappy was 30%. Worried was 20%. Feeling guilty and bad was 50%. Feeling inadequate and incompetent was 80%. Feeling self-conscious was 30%. Feeling discouraged was 50%. And feeling stuck was 30%.
So let me just look at those, and then you can read the negative thoughts. The really intense one here is the inadequate and incompetent, 80%.
Yes.
And I bet a lot of our listeners, whether you're a mental health professional or a patient or just a general citizen, have sometimes struggled with feeling inadequate or incompetent.
Yeah. So my negative thoughts, the first one is, I'm never going to get this, and that's 100%. And I don't know what I'm doing, 100%. I sound like an idiot / stupid, 100%.
We're only looking for distorted thoughts. Okay.
I was sort of like, stop me from, I was like, wait, what?
David's stupid humor. Fabrice hates my humor.
I don't know what to do now, and I should.
100%.
100%. Everyone's going to know that I don't know what I'm doing, 100%. And the last one is I suck.
Okay.
80%.
Beautiful. Now, which of these thoughts would you like to work on first?
I think these two are kind of the same. I don't know what I'm doing.
Okay. Now, here's the way I set up the paradoxical double standard technique, and the details are pretty important. I'm going to be a female friend of yours, not somebody you know, but just give me a name.
Sally.
I'm Sally. Now, what I want you to know, Eleanor, is that I look a lot like you, and I am a lot like you. And in fact, you could think of me as a long-lost identical twin or a clone, something like that. And I went to all the same schools you went to. I got the same grades that you got. I have the same kind of career that you have. And all of my strengths are the same as your strengths, and all my weaknesses are the same as all of your weaknesses.
Okay.
And what I'd like to do is hear how you would talk to a dear friend. Is that okay?
Sure.
Okay, so Eleanor, I'm wondering if I could talk to you for a minute?
Sure.
I don't know if you're aware of this, but I'm in this new Tuesday night training group at Stanford.
Mm-hmm.
We're learning this new form of psychotherapy called Team CBT. And it's quite different from what I've been trained in, quite different from what I'm familiar with. And the other night we were working with some of the newer members of the group on this process resistance technique to melt away the client's resistance. And I got to feeling pretty inadequate and incompetent, and I was having some negative thoughts. And I was wondering if I could share them with you and see what you think?
Yeah, absolutely.
Well, one thing that I was telling myself is I don't know what I'm doing. What do you think about that?
Well, I think you said you're learning these techniques, right?
Yeah, it's all new stuff.
Yeah. Well, I would imagine that your peers probably have similar thoughts sometimes because you're learning something. And that it's probably not actually 100% true because you're actually in the process of learning something. So it sounds like it just might be something different and maybe feels a little uncomfortable trying to pick up the different techniques.
Great. Now, who won that exchange?
I think I did.
I thought you did too. Now, what I'm going to do as the therapist, this is just teaching the listeners, is I'm going to start cross-examining you now.
Oh, dear.
I'm going to continue to be Sally, and I'm going to yes-but you the way a patient would typically yes-but a therapist.
Okay.
I'll be friendly, but okay. So What you told me right now really makes sense, and it helped me. You said that I'm learning something new, and that I am learning some things, but probably the other newbies in the group don't exactly know what they're doing either, and that it's okay, that I'm doing just fine. Is that what you're telling me?
Yeah. Yeah, I think you are doing just fine. I think maybe I wasn't clear because I think you do know something.
Oh, I see. So you're saying that I do know something. I am learning. Now, is that true, or are you just BSing me?
Well, you're still in the group, right?
Yeah, but they're nice. They don't tend to kick people out.
Are you practicing the things while you're there? Are you?
Oh yeah. Oh yeah. I practice there a lot. Every night we practice stuff. And so you're saying I'm there and I'm practicing and I'm actually learning things.
Yeah.
And the fact that it's hard is kind of exciting because it shows that it's new.
Yeah.
Oh, and that's true.
But sometimes when we learn things, it can be hard, right? When we learn things, not everything comes to us that easy. This is not easy stuff, right? If it was,
yeah,
we wouldn't be sitting in a class learning it.
So that's cool. And what you can see, Eleanor and Fabrice, is the power that you found within yourself that was unleashed in this way. And then what I would do, I'm not going to slow us down to do it now, but in an actual session, then I would have you write that in the positive thought column and then see how much you believe this thought. I don't know what I'm doing, and hopefully we could reduce that down to 0 or 10 or something like that. But that was killer. But to keep our momentum going,
okay,
I'm going to just go on to another thought. And generally the same point I made in the last podcast, the patient only needs to crush, usually, the first negative thought. And then there's a switch in the brain, as we can kind of see in you already. And then generally the patient can just blow all the negative thoughts out of the water. And this is quite different from the way conventional therapy works, where you're chipping away at things for months, weeks or months, or even years. This is something that happens real fast. But anyway, well, you helped me so much on Eleanor, but I have this other thought that I probably sound like an idiot. I probably sound stupid.
What makes you say that? What?
I just feel, because I feel inadequate. So I figure probably when I say things, they don't tend to make sense.
Well, I guess I would wonder, how do people respond to you? That I'm curious, like, what would lead you to think that, like, you're doing this work, you're learning things, so is the feedback you're getting from your peers and the instructors?
Actually, they haven't said things like that to me. In fact, even right at this moment, I'm probably sounding pretty intelligent. Right?
Yes.
Right. So who won that one?
I did.
Big or small?
Big.
Big or huge?
Huge.
Yeah. But can I ask you some more
Sure.
questions?
Please.
Sometimes I tell myself I don't know what to do now, and I should know what to do.
So you think that you should know what to do?
Like when I'm learning new shit in groups.
Gotcha. Well, where does that idea come that you think that you should know what to do? Does everybody else know what?
No, most of them struggle a lot to figure, because especially the resistance techniques are among the most difficult of all.
And I imagine that part of the reason why you're going to the group is so you can learn these techniques and you're practicing them with your peers so that you're getting better at them, right?
Oh, I see. So you say it's okay, it's even good that I don't know what to do, because I'm learning new things to do.
Yeah. Yes.
And is that true, or are you just being nice?
No, absolutely.
Okay, good. Well, you've been helping me a lot here, but sometimes I tell myself I'm never going to get this. What do you think?
I think it probably feels tough for you when that thought comes up.
It is. So are you agreeing with me that I am never going to get it?
No. I've seen you do some amazing things. You drive this distance. You have the motivation to actually be in this group, and you keep going back. And you do these experiential things with your peers, it makes me think, like, how are you not going to get it? Because you do the work, you do the practices, you're showing up.
Well, you're helping me with that, but I've been also telling myself that everybody's going to know that I don't know what I'm doing.
Yeah, everybody else might feel a little bit of that as well in the class, because if you guys are fairly new and you're learning the technique, at some point, people are going to have thoughts about not really knowing what to do. It's the whole point about being in the class.
Awesome. Who won that one?
I did.
Yeah, absolutely. Well, the last one I've got here is I'm telling myself that I suck. Do you think I suck?
No, absolutely not. I find you amazing that you drive the distance, that you go to this class, you do all this work. I think what you're doing is incredible.
Well, that's fantastic. And then I would just ask you, and you can do it for homework, just to put all those fabulous positive thoughts in the right-hand column and see if there's any belief left in all these negative thoughts. Are there any that are left there that we still should do? I felt like you clobbered all of them. Did you feel that way too?
Yes, I did.
And well, what allowed you to do that? And was it real, or are you just helping out the old fart?
No, it's definitely real. And I guess it took a little bit for me to sort of settle into that and realize that is true. And that is what I would say to somebody. And that is also true for myself.
Yeah, it's really neat.
I like this demo. There were a couple of things that I have a question about. In the way that I've learned the paradoxical double standard, there's a little clincher at the end where, of course, the client defeats all those negative self-talk from the quote-unquote friend, but we haven't reversed the paradox yet. And wouldn't you say at the end, oh, so if this is, like you're not blowing smoke in my face, if this is really true for me, wouldn't that be true for you too?
Oh, right. Good point, Fabricio. You picked up on that automatically, but for a patient, you would have to spell that out.
Yeah.
And then just say, so if it's true for you too, then write that in the right-hand column, the positive thoughts column. And remember that to be effective, we need the necessary and sufficient condition for emotional change. Do you know what they are?
It has to be the truth.
Yeah, 100% true.
And I can't remember the second one.
It has to drastically lower the belief in the negative thoughts. And if those two things happen, then all these negative feelings will pretty much instantly disappear or go down dramatically.
Yeah. The other thing I noticed is that at some point, Eleanor was asking you, the friend, some questions, maybe to draw some specifics. But I'm wondering if that might not actually detract from the client's own work.
Yeah, we slipped into bad technique there. You paused the recording and pointed that out, and we got back on track. But that was a really important point that you made. The patient shouldn't go into a therapist role and start asking questions, but should crush the negative thoughts.
Yeah, because they're really doing their own work.
Yeah.
They're talking as a good friend rather than as a therapist.
Right.
Yeah.
Any other neat comments or questions or observations? You always have a way of putting things into a really clear and understandable package.
I'm running out of questions.
Well, the only last comment I'll make, and then you might have one, Eleanor, is that the nice thing about this technique is that it's very gentle and would never threaten anyone. Externalization of Voices that we did last podcast is flashier and arguably more mind-blowing and powerful, but it's a bit threatening.
It's challenging.
It's challenging, whereas this technique would never hurt or upset a patient. It's very gentle. It isn't always effective, which is why we have 50 techniques. If one doesn't work, you try another one. But if you've done good paradoxical agenda setting, then more often than not, these techniques work right away.
well, one might say that this is a technique that is, better applied when there's a lot of self-defeating beliefs. Number one, and also when you are with a client who is more bent toward empathy. Somebody who's
compassionate.
Who's compassionate, who'd be a good friend.
Yeah.
If you're working with a psychopath, it might not work as well.
Yes. I had a patient, I tried it once, who had borderline personality disorder, and she hated herself and wanted to commit suicide.
Yeah.
And she hated other people.
Yeah.
And so I tried it with her, and I said, she was a teenager. She was one of my first cognitive therapy patients, and she had been hospitalized for years at the time they referred her to me, because she was always trying to self-mutilate or kill herself. Mm-hmm. And I said, like, if you were talking to a young lady just like yourself, and she had all the characteristics of you, and, what would you say to her? And she said, I'd tell her to go home and put a effing bullet through her
an
head.
end to it.
Yeah. So it wasn't very helpful.
Cut the losses.
Yeah. So I went on to another technique. We found another one that did work for her, but it doesn't work for everyone. But
exactly.
it's a really neat thing.
That's why there's a number of techniques that people can choose from.
Now, once again, tell us what it was like for you, and then we'll bring this to an end, because the listeners are saying this is too slick, this is too quick, this wasn't real, this was a plant or something like that. Did you actually change in your emotions?
Yeah, it for me, because this is like my go-to, how I feel when I'm starting something new. So it took a little while for me to let go and all of a sudden realize, like, oh, yeah, that is true. Yes, I do actually drive a long way, and
that was
I
cool.
show up and I work really hard. And so I don't think I had seen the other side, because literally we just used that in our
it's like
group.
seeing something for the first time. It's like when you see the Grand Canyon. Oh, my gosh, this is fantastic. Let's just put a little icing on the cake here.
Yes.
We'll just do a minute of externalization of voices. Sometimes I'll do that to make sure the client really has it.
Okay.
And what is your name?
Do you want my real name? Or I was like, am I pretending? Eleanor.
And what's my name?
Eleanor.
That's right. So this time I'm going to be the negative, brutal Eleanor, and just make sure that you, Eleanor, can crush these thoughts. Could I talk to you for a minute, Eleanor? And this is the one we did on the last podcast.
Yes.
Or just a little quick review of that. Could I talk to you?
Yeah, absolutely.
Yeah, I just want to remind you that you're never going to get this stuff that you're learning in group.
That's not true at all. I show up, I do the work, I will get it. I'll get it.
Yeah, but you sound like an idiot. You sound stupid.
That's a judgment statement, and that doesn't have anything to do with what I'm doing. I'm authentic. I work when I'm there, and there's not even anything to say to that, because it doesn't even make sense.
Who won?
I did.
Big or small?
Big.
Big or huge?
Huge.
Yeah, but the fact is, everyone's going to know that you don't know what you're doing.
It doesn't really matter what other people think. It's more about the work that I'm doing and what I'm getting out of it.
Mm-hmm. Who won?
I did.
Big or small?
Big.
Big or huge?
Huge.
Yeah. You want me to show you another way to defeat that thought?
Yes.
Hit me with the same one. You did it through self-defense. I'll show you how to do it through the acceptance paradox.
Okay. Everyone's going to know that you don't know what you're doing.
Well, then they'll know for sure. That'll be the truth, because I'm often confused and I'm learning all this new shit. It's actually kind of exciting.
That's true. Yes.
So who won?
You did.
Big or small?
Big.
Big or huge?
Huge.
And that was just through self-acceptance.
Yeah.
This one we can defeat it in either way.
Yeah, that's true.
And the last thing I wanted to remind you, and don't you forget it, Eleanor, that you suck.
That is just a load of crap. Not even true.
Who won?
I did.
Big or small?
Big.
Big or huge?
Huge.
I'll show you another way to do it.
Well, Eleanor, you suck.
Yeah, but you want to know the miraculous thing about it?
What's that?
My patients and colleagues don't even notice. or care. Maybe the other way was better on that one.
No, actually, that was a good way to wrap this up.
Right.
So I think people will appreciate, especially since we've seen the externalization of voices last time. All right. So thank you, David, and thank you, Eleanor.
Thank you, Eleanor, for bringing your spark to the podcast. Really made it neat.
Thank you for letting me be here.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this podcast under the blog page, and where you can leave your comments and questions. The website has an abundance of resources for therapists as well as non-therapists, including books, workshops, a list of online training groups around the world, and much more. Theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Fabrice Nye, and I invite you to join us next time for another episode of the Feeling Good podcast.